Currently, two forms of pastoral counseling are practiced: a brief, time-limited form that is problem-solving or solution-focused, and a long-term form that is often psychoanalytically oriented and focuses on personality change. Clergy and other ministry personnel who have some training in pastoral care and counseling provide most of the short-term pastoral counseling. However, persons with formal, supervised training in counseling and psychotherapy and who are certified and are licensed can practice what is called pastoral psychotherapy. Pastoral counselors organize their thought and work around their pastoral identity. They integrate behavioral sciences and theology. When asked, what makes the counseling you do pastoral rather than some other kind of counseling? Almost all pastoral counselors answer with, my identity. Pastoral counselors integrate theology and behavioral sciences and hold spirituality and psychotherapy together. Holding science and religion together is an epistemological problem. Epistemology asks, how do we gain knowledge, and how do we know what we know is trustworthy? This is a particular problem from science and religion, since they approach knowledge differently. Religion relies on tradition, personal experience as interpreted by a community, spiritual practices, and the authority of text or spiritual leaders. Science relies on hypotheses, tested by empirical observation, measurement, experimentation, and consensus of a scientific community. Ian Barber describes four common epistemological positions for managing the information from the two sources of religion and science: conflict, independence, dialogue, and integration. By examining these, we can clarify how pastoral counselors manage the intersection between behavioral sciences and religion, and how they can select appropriate methods for integrating their work in a pluralistic culture. The position of independence assumes that science and religion are entirely independent and autonomous. Each must tend to its own business and not meddle in the affairs of the other. Both produce their own knowledge without eclipsing the other. First, because they represent separate domains, and second, because they have different languages, methods, and functions. God's domain is history, science domain is nature. The independent position allows a faith tradition like Christianity to prioritize the Bible as the record of revelatory events without resorting to biblical literalism or the certainties of creation science. It also allows scientists to give priority to their discipline in matters of research and application, but retain faith as a personally organizing foundation. Counseling and psychotherapy are often interchangeable terms that describe the process of helping another person make some psychological or behavioral change, typically from a less adaptive to a more adaptive stance, and often described as talk therapy. Counseling and psychotherapy incorporate explorations of thoughts, feelings, and behaviors for the purpose of helping the client solve problems or achieve a higher level of functioning. Research shows that the independence is a relatively common position for religiously conservative pastoral counselors, those who work with non-religious clients, and those who work in public mental health context. It is also common among counselors who train primarily as psychologists, marriage and family therapists, social workers, and professional counselors who augment their work with spiritual competencies. The dialogue position expects that a mutually informing conversation between science and religion is possible, because ultimately the two ask similar questions and use similar philosophical methodologies. Barber takes this one step further. He suggests that the Christian doctrine of creation requires relating science and religion in some mutually constructive way. Creation proposes God created both form and matter. The universe is orderly, and the details of this order are known by observation. And the created order is good and worthy of exploration, but is not itself divine. These propositions legitimize science as a way to explore and describe God's creation. They also make space for science to raise questions that science itself cannot answer. Dialogue allows mutually informing, creative correlation between behavioral sciences and theology. The dialogue position allows information to cross and enrich the knowledge of both science and theology. But it also maintains a firm boundary between the two. Integration softens this boundary to encourage the convergence of scientific and theological knowledge. Since there is one creation, and theology and in science are interpreting the same creation, there must be coherence between theological statements about creation and scientific observation. However, natural observation and the technologies produced by science raise moral and ethical questions that demand a similar coherence. Since there is one creation, and theology and science are interpreting the same creation, there must be coherence between theological statements about creation and scientific observation. Barber identifies this position as an integration position. Natural theology is a way of creating theological statements based on natural observation. God's nature and existence can be inferred from the design of natural order. Science describes this design. The conflict position assumes an irresolvable conflict between science and religion, sometimes described as open warfare. Science and religion make competing, literal statements about the same domain. This forces an uncompromising choice, often between scientific materialism and biblical literalism. Scientific materialism takes a rigid stand based on the dual assumption that only the scientific method can produce reliable knowledge, and that the reality of the universe is restricted to matter. Religious knowledge, spiritual experience, and belief are fundamentally unreliable because these cannot be verified with experimentally tested data. Biblical literalism claims that Scripture is inerrant throughout and is the final judge of all knowledge, including scientific knowledge. Biblical literalism is expressed in the biblical counseling movement and in religious traditions that discourage any form of counseling in favor of strict religious practices. Biblical counselors reject all behavioral sciences and psychotherapy and claim these are humanistic, devoid of God, and part of an anti-Christian culture of materialism. There is great strength in the pastoral counselor's sense that boundaries between behavioral sciences and theology, spirituality, and psychotherapy are organized by personal pastoral identity. This is critically important as pastoral counselors move beyond the shared assumptive world of specific religious community and enter pluralistic public institutions and join in public discourse about caring for humanity that is psychologically and spiritually hurting. Pastoral counselors act as agents of transformation by forming therapeutic relationships that help people change or cope with things that cannot change. Pastoral counselors regard their work as successful when clients change what they can to improve within their spiritual, emotional, or relational life, or change their attitudes when other improvements are impossible. Lambert identifies 4 factors that account for change in counseling. Client-therapist relationship variables. In other words, an emotionally charged relationship in a healing setting accounts for 30% of positive outcomes in counseling. Second, client variables or extra therapeutic factors such as client motivation, active participation, a client's belief system. This accounts for 40% of change. 15% of change is determined by hope, or the client's expectation that things can change. And 15% of change in therapy is related to a therapeutic model. Hubble, Duncan, and Miller suggest all therapy models and techniques share a common quality. They all prepare clients to take action on their own behalf. Pastoral counselors believe they form a unique relationship with clients. More than 3/4 of those interviewed spontaneously called this pastoral presence and described it as a characteristic of the pastoral counselor's identity. It is the motivating factor that drives and contains interactions between client and counselor. Pastoral presence is described as a meaning-constructing interaction between counselor and client, and not an individual quality that the pastoral counselor brings to therapy for the client. Studies indicate that the therapeutic relationship itself is more powerful than any specific cognitive, behavioral, or psychodynamic therapeutic procedure. However, it is equally true that client perception of the relationship is most important. Research shows that religious involvement, personal faith, and spirituality have positive effects. It appears that a large majority of people turn to religious resources to cope with life stress, personal loss, natural disaster, war, mental and physical illness, and other problems in living. Koenig suggests religion and spirituality can benefit therapy by promoting a positive worldview, helping clients make sense out of difficult situations, providing purpose and meaning, discouraging maladaptive coping, enhancing social support, promoting other-directedness, helping clients release the need for personal control in uncontrollable situations, also helping clients with appropriate forgiveness, encouraging thankfulness, and encouraging hope. When pastoral counselors bring the notion of pastoral presence to sessions, they express a transcendent hope that God is active and present in counseling sessions. They also bring a rich tradition of spiritual stories, religious ritual, and communal connections. These expand hope beyond the temporal factors of a client's demoralization and can stimulate new pathways and agency thinking, and can suggest extra therapeutic resources to support hope and change.